Hi, my name is Maya Ingeman, and I'm a product manager at Coloplast. This brief in-service video will walk you through how to use the SenSura Mio Baby barrier and pouch and Brava Baby adhesive remover, indicated for babies 30 weeks of gestation to 6 months of age. This information is for educational purposes only. It is not intended to substitute for professional medical advice and should not be interpreted to contain treatment recommendations. Prior to use, refer to the product instructions for use for intended use and relevant safety information. Gather all the supplies you need in advance, either a cutting template from your previous pouch change if you have one, or a stoma measuring guide, a marking pen, a disposal bag, curved scissors, a barrier, pouch, a sachet of adhesive remover, a medicine cup, cotton wipe or washcloth, and gloves if you're using them, or if you're a caregiver changing the pouch at home, some cotton swabs. Measure the stomas or stoma carefully at the point where it meets the skin. Note, the stoma may be bigger at its opening, so it is important to measure at the base of the stoma, where it is joined to the skin. If you have a template from a WOC nurse, this may be a good tool to use. Using your marking pen, trace the measurement on the back of the barrier, ensuring that the stoma will fit inside the blue oval that denotes the max cut zone. Cut a hole in the ostomy barrier using curved scissors to exactly match the size and shape of the stoma. Peel back the adhesive backing from the barrier using the blue tab. Dispose of the backing in the disposal bag. Center the barrier opening around the stoma or stomas and smooth the barrier adhesive onto clean, dry skin, starting from the center around the stoma and moving out toward the edges. Apply gentle, warm pressure for a couple of minutes to seal the barrier to the baby's skin, especially around the stoma. Before you apply the pouch to the barrier, be sure to close the outlet on the pouch. Peel off the adhesive backing on the pouch and dispose of the backing in the disposal bag. Make sure the flange is clean and dry. Line up the adhesive ring to the blue flange, ensuring the pouch points in appropriate direction, for example, to the baby's side or toward the baby's feet, an easy way to drain. Starting at the bottom, smooth your fingers across the entire adhesive ring to ensure it is well secured. Clean up any remaining supplies and throw away the disposal bag. Do not flush it down the toilet. There are two different ways to empty the pouch depending on your facility's protocols. The first is to empty direct from the outlet. To do so, pinch the outlet like you would the spigot on a beach ball and, while pinching, point it upward and remove the plug. When you're ready to empty, relax your hold on the outlet and direct it into the appropriate container to drain the pouch. After drainage is complete, be sure to reinsert the plug to close. If you choose to empty with a syringe, use an appropriate enteral syringe to fit the outlet and drain the output from the pouch. This outlet is designed to fit oral enteral syringes to minimize the risk of small bore misconnections. The SenSura Mio Baby pouch has a built-in access window, which looks like a blue sticker on the front of the pouch. You can expel gas from the pouch by peeling back this access window. Ensure no particles are on the sticker or pouch film before resealing. Do not fully remove the access window. If you're using the access window to perform a procedure like refeeding, change the pouch after the procedure or refeeding cycle is complete. Bend the perforated edge of the adhesive remover sachet back and forth several times to prime it for opening. Then carefully tear it open and pour it into a medicine cup. Grasp one of the tabs on the blue flange with one hand and, using the blue tab, peel the pouch away slowly to remove the pouch from the barrier. Then drain the pouch according to hospital and patient requirements. Using a gloved finger or a cotton swab, apply some of the oil-based adhesive remover to the edges of the barrier. Grasp the removal tab on the barrier with one hand and gently remove the barrier from the body, using your other hand to continuously loosen the barrier from the skin using the adhesive remover. Dispose of the pouch, barrier, and adhesive remover, as well as any cotton swabs you may have used, in the disposal bag. Thoroughly clean the peristomal skin with water. Allow to dry. You may optionally use a cotton wipe or washcloth to gently pat skin dry. Thank you for taking the time to view this module. For additional ostomy education, please visit us at www.coloplast.us.